Hello, this is Dr. Hizon again to talk about the medical documentation, this time for the Medicare annual wellness visit. As a disclaimer, please refer to your particular doctor. This is a general course not intended to be medical treatment. Your particular situation may vary. So AWV, annual wellness visit, it provides an opportunity for the beneficiaries, which are the patients, and their healthcare provider to develop and update a personalized prevention plan. The plan is to prevent illness based on current health and risk factors, and it's covered once every 12 months. Patients who have Medicare Type B for more than 12 months are eligible. Patients who have not received an initial preventative physical examination, the IPPE, or annual wellness visit service, within the last 12 months. So patients can be prepared by being encouraged to bring the following information to the provider, and that's past medical history. And who can provide the annual wellness visit? Well, that's a healthcare professional, typically a physician, physician assistant, nurse practitioner, and advanced provider. So the AWV, the annual wellness visit, is a preventative visit, not a routine physical. It is something that is to try to maximize the preventative services that are available to Medicare beneficiaries. It is not a head-to-toe physical examination. On your first annual wellness visit, when they turn 65, usually there's a health risk assessment. There's multiple assessments. We'll look at medical and family history, list of the current providers and suppliers, do their vital signs, check for cognitive impairment, meaning do they have any dementia, look for other risk factors like as depression, functional ability, level of safety, and review their functional ability. So there's a written screening schedule, such as a checklist for the next 5 to 10 years. This is what we're trying to establish. We're trying to prevent as much as we can. List the risk factors and conditions where interventions are recommended, and give personalized health advice and referrals for health education and preventative counseling, and furnish advanced care planning services such as a PULSE, the Physician Order for Life-Sustaining Activities treatment, which is called a PULSE. And then subsequent annual wellness visits, those are done annually afterwards, and they'll look at health risk assessment and look at vital signs as well as detect any cognitive impairment. And then there's subsequent annual wellness visits where you update everything. And again, always be looking at advanced care planning services. In the health risk assessment part, this collects self-reported information known to the beneficiary. It can be administered by the beneficiary themselves or the healthcare provider. Usually it takes no more than 20 minutes to complete, and it looks at demographic data, self-assessment, psychosocial risk, behavioral risk, and activities of daily living, as well as instrumental activities of daily living. Now, how to code for this visit? It's usually a G code. So the initial AWV is a G0438. After that, it is a G0439. This is a subsequent visit. So initial visit is the 8, the subsequent is a 9. And there is no specific ICD-10 code that is used, so these are CPT codes. But the ICD-10 code that most of the time is used is some sort of Z code, and so Z00.00 is when it's a exam, but there's nothing wrong with the patient. If they have anything, say diabetes or hypertension, then it would be a Z00.01. And in terms of how much they get paid, these are some in 2019, essentially about the level of payment. And how often? The first visit, the G0438, is once in a lifetime. Subsequent visits, G0439, are annually after the first full exam. And there may be co-insurance and deductibles with that. And these codes, again, go along with the personalized prevention plan of service. So pearls and pitfalls for the AWV, the annual wellness visit. If they have any medical problems that have laterality, make sure you get the correct side, make sure you get the correct gender. Be sure to document all annual wellness visit requirements, including the health risk assessment. Learn the various questions to ask and required forms. It's quite extensive. And then please ask your doctor or healthcare provider that you are documenting for if you have questions about the annual wellness visit or AWV. And again, with primary care, always be asking about quality measures such as when is your last mammogram, pap smear, and other preventative services. So takeaway points: the AWV is for providing personalized prevention plan and services, and you'll see this also termed a PPPS. The plan may help prevent illnesses based on their current health and other risk factors. An AWV is not a head-to-toe physical exam, and I think as an informatician, you need to learn the various questions to ask, as well as read up on more on the annual wellness visit requirements and where to document those in the electronic health records. And once again, we want to thank you, because while doctors save lives, medical informatics specialists, scribes, save doctors. Thank you.